In this video today, we're going to talk to you about how can you tell if you have a vertebral compression fracture. What does that mean? It means a broke bone in your back. If we haven't met, I'm Dr. Orlando Landrum. I'm a physician that helps patients understand both their physical as well as their mental health and how to be able to optimize it best so they can be able to live longer and live better. Today, we're talking about vertebral compression fractures and how that might impact you. At the end of the day, what you want to know is, can you figure it out before you have to go to an urgent care, before you have to go to a clinic, or before you have to go to a hospital? Because who really wants to do those type of things if you don't have to? So today, we're going to talk a little bit about that. We're going to explain to you exactly how to be able to do that on yourself. But before we get to that, we want to give you an idea about, are you potentially at risk? And what might have happened before you happen to have this vertebral compression fracture? For most people that have back pain, they typically think, oh, well, it might be secondary to being something like a muscle, or it might be because I have some degree of arthritis and I just feel it in my back and I kind of just, walk it off. It's something that I just kind of get over. Maybe I take a medication like an ibuprofen and I end up getting better. It's sometimes worse with activity when I go about doing things like cut the grass or do, shovel snow, things like that. But it's just something that's present. For others, they feel it when they're seated and it just bothers them. And the thing kind of pops up in your head. Is this more ominous? Is there something that I need to be worried about? And I'll tell you, as a doc, having taken care of a number of patients, I would say 9 times out of 10, what most patients think in terms of it being a problem outside of after it being an arthritis or being a muscle issue is they think they have a herniated disc. Well, the likelihood of having a herniated disc is pretty decently high, but it doesn't always result in back pain. Quite frankly, it typically results more in leg pain, something we call lumbar radiculopathy or sciatica. But when we're looking at back pain and we want to kind of tell, is this a compression fracture? One of the things we really want to be able to identify, is this something likely to happen to me? So who are the patients that normally potentially have a problem with compression fractures? Traditionally, there's someone who are more mature in age, so traditionally greater than 60 years of age. They normally have had a number of different falls previously, though that doesn't always have to be the risk factor, which many patients will say, I didn't have a fall. I don't understand. How did I have a compression fracture when I have been stable, steady, nothing's happened, no trauma? But if you have had episodes of falls, just because you didn't notice immediate pain does not mean that you don't have a compression fracture. Anyway, so moving on, who else could potentially be at risk? Those people who have osteoporosis or those people who have osteopenia. So what's the difference? Osteoporosis is when you actually have documented decrease in bone density to the extent that you really should be having medications that try to be able to increase that density or strength. When you think about osteopenia, it means that you have a thinning of the bone, normally seen on different studies that can be done, but it doesn't always have to be immediate medication. You can do lifestyle modification in order to make some things better. Why is this an issue? The reason why this is an issue is if you imagine that you had a board and you're trying to snap it, the thicker the board, the more difficult it is to snap. So if you think about the element of having a bone that is thinner, that is not as robust, it's much more likely to have a fracture that occurs. Who are some of the other people that have issues? Patients that have medications that they take with frequency that can cause them to have a resulting thinness of the bone. So what else is likely to be a clue to giving you an idea about whether you might have something like a compression fracture? Well, one of the things that you might want to know is, does it affect potentially your breathing? So you normally see someone who has a bent over posture, who might be trying to catch their breath with activities, and they think, oh, well, maybe it's just because the pain is significant, that's why I have to bend over. Or if you watch some of our other videos, you'll talk about and hear about spinal stenosis and this aspect of something that's called shopping cart sign, where you have to be bent over in order to be able to do some of your activities. But there's another thing to this. When you have a compression fracture, it looks a little something like this. So you can see that there's a picture of the spine from the side, and from the aspect on the left-hand side is the spinous processes, and the front is the front portion of the spine, and you can see kind of midway down these breaks or compressions that are present within the aspect of the bone. What happens is if you have multiple ones of those, and sometimes only one in the right place, you can start to have what's called a kyphotic posture, where you bend forward. And that bending forward can compress your lung volumes and make it more likely that you have shortness of breath. So it's one of the ways to be able to kind of tell, particularly if you have more than one compression fracture, is this something that maybe I do have a problem with and I need to figure this out? So, what's one of the other things that could predispose you to this? And despite all the other things that are significant for health, being healthy and being safe and figuring out how to be able to live longer, traditionally, one of the things we want to be able to do is manage our weight. And we want to be able to be at an ideal body weight that traditionally would be in the case. However, this is where that seesaw goes the other way. Sometimes when you are lower body weight, it actually makes it more likely that you won't be as robust in terms of being able to deal with a compression fracture or a fall that might result. So those individuals who are thinner frequently have this as a potential problem. I know, problem, like, my goodness, I just can't win for trying. And I get it, but it's one of the things to be cognizant of. And there are different things that you can do to be able to prevent this from being an issue. And we'll talk about that a little bit, but we have some of that in some other videos. So how can you be able to tell if this is really a problem that's going on for you? So one of the things that you really need to be able to do is to be able to do the following, is if you can have someone, if you can't reach it yourself, be able to touch the midline of your back. So what does that mean in regular English? What that means is if you were to take a look at the aspect of the spine, and if you recall that video that we showed you before, where you can see that aspect of the spinous processes, which are these guys right here, what you want to be able to do is to see if you can be able to put your finger on that area and press. Why do you want to do that? Because if you have a compression fracture, fairly frequently, when you can reach that spot on your back and apply pressure there, you can identify it as being tender. So how does that differ from arthritis? Traditionally, when you look at the aspect of arthritis, what you're looking at is you're looking at and dealing with the joint. So if we were to take another model, we were looking at a vertebral body, and we can see that aspect of the spinous process, and we return this slightly, where the areas of the arthritis would sit would be in these joints that sit right in the areas in here. And that's what's going to give you a problem when you bend, when you twist, with cold weather, when you first get up in the morning. But a compression fracture is different. It sits in that middle midline position that applies pressure in that area, in that region. So if you can press there, frequently you can be able to tell, does this replicate my pain? Which is what we use in our own medical lingo to say, does this elicit the pain? Is this similar to what you normally experience? If you can apply pressure to that point, and you can define it as a discrete point, it's a possibility that that very well may be it. Now, is a compression fracture always due to trauma? No, there are other things that actually can be a problem. It can cause a compression fracture. Sometimes if you use steroids, whether that's for lung or whether you use it for arthritis and use high doses, it can predispose you or actually make it more likely that you have the possibility of having a fracture. So those are things that you need to be able to kind of adjust. Are there things that you can do to be able to prevent a compression fracture from occurring in the first place? Well, one of those things is to know what's going on with your bone density and be able to have your primary care doctor or nurse practitioner or whomever is your healthcare provider allow and evaluate what's going on with your density. So that way you can be able to say, how can I be able to improve this either with medication or diet by taking in medications that are going to improve what your calcium happens to be. And more importantly, to consider doing some weight loaded exercises. Now, depending on your age and how robust you might be from a health-wise standpoint, this is something that you obviously want to discuss with your doctors. But if you apply some degree of stressors to the bone in a safe fashion, it makes them have to be able to accommodate. They have to get stronger. And it's one of the things that you can do in somewhat your relative youth, because as we all know, we're all getting older, to be able to stress the bone to an extent so that way it can be prepared to deal with a much more aggressive stressor and not actually end result in it being a fracture. So What are some of the things that you can do in order to be able to improve this if you do have a compression fracture? Well, one of the things you want to do is to take a look at the video here, and you want to take a look at this video here, which both explain the utilizations of something that's called vertebroplasty and kyphoplasty, and the other that talks about something that's called spine jack. Those treatment options are options that are able to take a compression fracture that you sometimes will see that will look like this in a pictorial representation, where you see this compression, like a can being squeezed down. Or if you were to see it on x-ray, it kind of looked like this. You have something that's called a kyphotic angle, where you see this reduction in the bone, and be able to take that and restore it. And an element of kyphoplasty and vertebroplasty, traditionally what you're going to see is that it's expanded back to normal height, and you see this deposition of medical grade polymer, which is medical grade cement, if you would. And that cement provides structure and robustness, and it allows for the spine to be similar to what it was before. So in this picture, you can see this PVH and AVH, which represents posterior vertebral height and anterior vertebral height, respectively. And what you're able to do is to return it back to where it was before. The challenges is that that can also have some other issues in relationship to the spine, because it's all interconnected, as we would probably gather. But we have other videos that talk about that. If you found this video helpful, please hit the like button. If you have questions, or you have had either yourself or someone else that you know of that has had a compression fracture, please tell us about it and what was their experience, how did they get better, and how did they be able to figure it out in the first place. Thank you so much for your time, and have a great day.